So here is a kind of unboxing of the book of Pharmacological Classification by K.D. Tripathi. So this is the latest edition, January 2025. So here you go, my beautiful little new book. And I have a lot of dreams about this book to carry it all the time. And there is some kind of a scratch here which I will check out later. Let's look at it inside. It's blue this time, guys, not the brown. The latest book is green though. But I don't know why the classification book is blue. And here you go. So like I told you, the textbook's latest edition is green, 2025 edition, right? But the book, this one is blue, and the classifications also are going with blue. And this is the bookmark they sent me. One more page. Okay, so let's look at this book now in detail. Okay, so here they're telling you what and all is there in the book, right? So now let us say a patient comes to me with cold and cough. So I would go to cough. Where is cough, cough, cough? Cough, cough, cough. Where is cough? Respiratory maybe, right? Oh, here. Drugs for cough. So now as soon as I go to that. So here you go. What will you give those people? Yeah, levosalbutamol. Why didn't they write levosalbutamol? They should write levo, right? And what else do you give them? Ambroxol mucolytic, right? And a lot of them will have acetylcysteine, which is a mucolytic. And then you give them a chlorpheniramine, which is going to be a centrally acting. So it is a cough center suppressant antitussive. And what else? Dextromethorphan, you would have heard, right? So even not just that, you could look at the brand names of these cough syrups that you can directly recommend, right? Which of these do you recommend for your patients? Ascoril, you've heard of, right? Benadryl cough, then cherry cough. Have you heard of cherry cough? Right? Very commonly used, what is given. My doctor gives Astakind, then Brucid syrup, etc. I'm going to write them in a paper and probably stick it here. Whatever is commonly prescribed in our clinic, I'm going to write here, and I'm going to make it one-stop solution for me to get the information. Okay. And let us say my doctor, we are going to prescribe drugs for migraine, right? So many cases coming in with migraine. So what are you going to give them? Paracetamol, yes. And we give them what? If they have anti-emetic metoclopramide, that is also called as perinorm, right? And then you are going to give them naproxen maybe, right? What else do you give them as a preventive? Propranolol, right? I've seen them give that. So whenever my doctor or the person I'm practicing with gives something, I'm going to tick it, and I'm also going to practice the same kind of drugs, right? So this is going to be, like I told you, a one-stop solution for me. And I'm very excited to have this book, guys. Because whenever I see people prescribing things, I would like to see exactly where they sit in the classification and write those common names and the dosage also. So even dosage is there here, right? Like, let's look at dosage now. Okay, so let us say very generally people walk in for peptic ulcer, right? So we usually recommend S-omeprazole, okay? That's what my doctor writes, the person I practice with. And Now when as soon as we say S-omeprazole, how much should you give? You should give 20 to 40 mg OD only, once daily only, right? So what does he give? What drugs does he give? Is it written here? If it is not written here, I would like to write the brand name that he writes here also. So for me, I need to understand that as soon as I see the brand name, I should be able to also tell what drug was prescribed, right? So what common antacid preparations does my doctor prescribe? Digene gel, the person whom I practice with, okay, digene gel. Then I have heard of Gelusil. Okay, Gelusil you have tablet also, right? Liquid. Then what else does he give? I am going to make hell use of this book, right? Antimicrobial, if you give, you'll give H. pylori kit, right? This is what he prescribes, H. pylori kit, which will have what? Omeprazole, amoxicillin, tinidazole, and only 3 things, is it? Okay. H. pylori kit, HP kit, he writes a lot. And now 1 kit to be taken daily in 2 doses. So you should know how, that is also given here. So this becomes a very easy book for us to prescribe. And as it is the latest, it has the latest drugs also. Some older drugs I'm hoping they have removed. Right, which are the newer drugs? Let us see something written here about which drug, which latest drugs, what is addition in this book, what are the that kind of information is not there. That information here as to what has been added in this book or removed. But yeah, so I'm very happy, and I think once I use this book over 2-3 months, I can again open it and show it to you as to how much I have marked and how many things are generally used, commonly used, and the brand names and what dosage it is given by, etc. And where to not give, where to be very careful, where you should not give to pregnant or not give to children, right? All those things I'm thinking I will mark in this book. So a lot of dreams comes with this book for me, guys. Wish me all the best, and thank you, Mr. K.D. Tripathi and Amazon and the seller who sold it, and India Post for bringing it successfully to me with a delay of 5 days. Thank you. Bye.